All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. Today we're going to talk about Covaxin, which has been approved by India or Indian regulatory authorities in a restricted mode. So we'll talk about that what does that mean or what may that mean, in addition to AstraZeneca and I believe Pfizer's approval as well. So I am looking at many articles, and even in Lancet, I saw a couple of articles where they said that something is wrong, this should not have happened. And let me spill the beans right in the beginning. What happened is that the Covaxin has been approved without the phase 3 clinical trials data yet. And that is the reason that many of the researchers, doctors are saying, hey, we are not comfortable with this. And then if you look at their press release, which I would show you from the Indian medical authorities, they are saying that, hey, we have a situation where we need to be as aggressive as possible. So if I put my opinion out first, I think that India has been doing things different from the rest of the countries. For example, they have been giving ivermectin. For example, they were quite aggressive with hydroxychloroquine as well. They have been taking care of their population much differently from the others. So maybe this would also be something that would work out and pan out. So from a data point of view, I am also uncomfortable that there is no phase 3 trial and the result, and there is an approval. And then from their history, from their track records point of view, it may actually still work out. So we'll see what would happen. Let's look at the vaccine itself and let's see what they're doing. The discussion that we'll do today is, number one, what is the current state of Covaxin? Meaning, what do we know so far about it? Then we'll discuss how is it made. It is inactivated virus. So this is the first time we are going to discuss a vaccine that is inactivated virus. So we'll discuss the process of manufacturing such vaccines, and then we'll discuss how it is made. One area that I am deliberately going to leave out is the ADE. This is an inactivated virus. That means it would produce neutralizing antibodies and binding antibodies. That means there is a possibility for the ADE much more than other vaccines that are only spike protein. But ADE is a theoretical phenomena. If ADE was that, or antibody-dependent enhancement was that possible, that frequent, that prevalent, then people who had become infected before, they would have been getting ADEs much more often. So because that is not seen that much, I would not like to kind of create that dark cloud over this vaccine without knowing the data. So this is the agenda for today. Welcome to everyone. Let's start our discussion. Jana Taylor says, we're all doomed. Stay healthy, build immune system. Jana Taylor, if we are going to be stressed out that we are all doomed, then our immune system is actually not going to be that healthy. So let's stay a little positive as well. Okay, so let's start. The vaccine name, Covaxin, or BBV152. Type, this is the first time we are discussing an inactivated virus vaccine. So I think you'll be fascinated with the mechanism of action. How do we produce it? How does it work? Which would come later on. I want to provide the context and the basic summary of the discussion. And then if you wanted to stick around for the technical parts, you can. Platform, it is actually manufactured in cells. Just like AstraZeneca is manufactured in cells, then there are other that are manufactured in cells as well. And we know that the fetal tissue cells, or copy of the fetal tissue cells. Here, this is a Vero cell platform. Vero stands for green. So this is actually, these are the cells from a green monkey's kidney's epithelial cell. So it is an African monkey whose kidney cells are used to manufacture this vaccine. Phase 1 and 2 data has been, actually phase 1, 2, and 3 are actually continuing on together. And I would say that even production of the vaccine has started as well, because they've gotten approval. And look at this, and I would show you in the approval message, the authorities approved them with a couple of interesting words in the approval. One is restricted approval for vaccine. What is restricted approval for vaccine? Of course, they have some sort of a discussion with the company to say this is what restricted will mean for you. But what would restricted mean in general for a vaccine? Vaccine is supposed to be given publicly and to a lot of people. So they have put the word in there that it is a restricted approval. And then secondly, they are saying that the vaccine is approved in a clinical trial mode, although the production approval is not really the clinical trial. The phase 3 clinical trial is separately going on, where we know that there are going to be some people who would be placebo receivers, and then there are going to be people who would actually get the vaccine. However, when the approval has been granted, then people are going to get the actual vaccine, and there is no placebo there. But they still called it a clinical trial mode. So this is the kind of language that is not used and seen in other trials, and this is also a reason that people are becoming a little bit nervous. If I try to be positive and think about it, I think this is what is happening. Clinical trial mode means, and this is my interpretation, I may be totally wrong. Clinical trial mode means that they have given them the approval to administer the vaccine, not the placebo vaccine, but collect the data as if it was a clinical trial, meaning keep an eye on the adverse effect, keep an eye on the people who are vaccinated, see if they are getting the antibodies developed or not, see if they are getting infected or not, see if they are becoming severe or not. So the data collection and observation is like that of a clinical trial, but the placebo arm is missing. And I think that is fine. But these couple of words or sentences in the approval have caused a lot of debate and confusion, and some people are just upset, some are not upset. So anyways, phase 1 and 2 data has proven that the vaccine is safe and effective. 375 people participated, I believe, in phase 2, 18 to 55 years of age. I haven't yet been able to look at the whole data. I'm not able to find it anywhere. But what I read from various areas, from various places, number one, the vaccine has observed to create neutralizing antibodies. That means antibodies against the spike protein. It is also going to produce the binding antibodies, because the whole virus is given as an inactivated virus. So of course, there are going to be antibodies against other parts of the virus. Efficacy is still not known. So that is the interesting part, that without the efficacy's knowledge, the vaccine has been approved. Side effects, there are still discussions, and the data needs to be still out. The redness and swelling on the local area of administration, fever is the common side effect as well. But again, those percentages and the data, I do not have that yet. There was one death that occurred, I believe, 9 to 10 days after the first dose administration. And the company came back and they said it is not related to the vaccine. The death, I think it was ruled out to be a poison, but they said it's not related to vaccine. Phase 3 is still continuing as well. To date, 25,800 volunteers for the phase 3 have been requested, and then 22,500 people have been vaccinated in phase 3. Animal testing was done, and the animal that were tested this vaccine on, mice, rats, rabbits, Syrian hamsters. Of course, the public's reaction and experts' reactions are mixed in this one, and I would show you some of those reactions. And finally, doses. There are 2 doses, either 2 weeks apart or a month apart. Again, this vaccine is still in phase 1, 2, and 3 altogether, and now even in production. So the exact doses which would be the final dose to be used, and the difference between the days, that still need to be firmed up. Currently, the doses that were tested were 3 microgram and 6 microgram, and then 2 weeks apart or 28 days apart, I believe, 3 weeks. So this is the basic idea of the vaccine. It is endogenously produced vaccine. That means it is produced within India. So there is a matter of pride. There is a sense of pride as well that the country made its own vaccine, which is all good. But there is some level of concern as well. So with this, let's continue now for how the vaccine is developed and how does it work. So if you just wanted to understand what this vaccine is, we are good. You can actually take off if you want. But if you wanted to understand how the vaccine is made and how does it work, then let's look at the next part as well. Now, before I go to the vaccine making part, let me show you the press releases. So this is Ministry of Health and Family Welfare, India. And here, if you see, this is 1st and 2nd January 2021. They have made recommendations in respect of proposal for restricted emergency approval of COVID-19 virus vaccine. They have approved Serum Institute with Pfizer, and then, with AstraZeneca, and then Bharat Biotech as well. And if you see here, I'm going to go down to the Bharat Biotech, this part. I believe M over S is manufacturers, probably. Bharat Biotech has developed a whole virion inactivated coronavirus. So whole virus, coronavirus inactivated. In collaboration with ICMR, I believe that is the Indian Council for Medical Regulation, and NIV, that is probably their health administration from Pune. And what they did was, and I would look at that in a second, they took the live virus and then they cultured that virus, then they killed it, and then that is the vaccine. So this vaccine is developed on Vero cell platform. We'll talk about that. And they say that this platform, Vero cell platform, has been used for many other vaccine making as well. So it is not a new platform, and its safety and efficacy has been established for decades, which is fine. Now, what I wanted to look at is the words here, which are so look at these last couple of lines here. It says vaccines of MS Serum and MS Bharat Biotech are being approved for restricted use in emergency situation, and permission is being granted to MS Cadelia Healthcare Conduct for something else. And you would also see one more, and that is the in-vax trial mode. So if I search for the word here, trial mode. So here, if you see here, they say the subject expert committee has reviewed the data on safety and immunogenicity of the vaccine and recommended for grant of permission for restricted use in emergency situation in public interest as an abundant precaution in clinical trial mode. So again, if I interpret that why are they saying restricted use in emergency situation? They're saying, well, we would let you administer this at this time because we are in a bad situation, emergent situation. So fine, just go ahead and do it. If it was not an emergent situation, if the pandemic was under control, they would probably say, no, you need to go do some more testing. I'm trying to be positive about this. So then before we look at the manufacturing part of it, this is the Lancet. And in the Lancet, if you see, this is one here, India begins COVID-19 vaccination amid trial allegations. This is January 23. So today is January 27 in the US. So this is Anu Bhuyan, who is the author of this one. And he is saying that why is it started as an approved vaccine while the trials are still going on. So if you see here, in January 2021, India's drug regulator issued a restricted emergency approval for Covaxin alongside Covishield, that is Oxford AstraZeneca developed vaccine that is also made in India. And then here somewhere, The Covaxin trial was not paused despite the alleged death of a participant. In an official statement, Bharat Biotech has said that the participant had died 9 days after taking part in the trial. The post-mortem report says that the person had died from a suspected poisoning. Company said that that is not related to vaccine. Then here is one more. This is again in the Lancet on January 25th. And we know that the Lancet and others have done hydroxychloroquine kind of things too. So again, there is I'm not trying to defend this. I want to keep it balanced. At the same time, yes, there is a gap here, and that is that the phase 3 is not done. The data for efficacy is not known. So without knowing the efficacy data, saying to give the administer the vaccine is a problem. But here we are. So if you look at this one, the second one, Bharat Biotech and the National Institute of Virology, which is a branch of the Indian Council of Medical Research, the Indian Official Authority for Medical Research development team isolated a strain. So how did they make it? They took a strain from a patient who was asymptomatic. Then they developed that into a vaccine by culturing that virus a lot and then killing it. And I know that somebody is going to put a comment that the viruses are already dead. So let's use a correct term, inactivating it. And I'll explain what inactivation means. There is an urgency and feeling of moral obligation. So a bunch of discussion here. But again, the point is there is an objection here to say, why have they done it? Then this is another article. This is about Bharat Biotech ICMR published Covaxin Phase 1 data showing safe enhanced immunity to COVID-19. Then here there is a doctor mistake to authorize Covaxin without Phase 3 data, Dr. Ashish Jha. And I believe he is the dean at the Brown University School of Public Health. So Brown University, I believe, is in Rhode Island, one of the Ivy League universities. And this is 24 Jan. And I read his statement over here that he said, I would not take this vaccine for myself. So that is his point of view. And finally, one more article here. Scientists urge government to release Covaxin Phase 3 trial data before rollout. The reason for that is this. In this data here, in this press release here, if you read the government's message, they say, the Phase 3 efficacy trial was initiated in India in 25,800 volunteers, and till date, 22,500 participants have been vaccinated across the country, and the vaccine has been found to be safe as per the data available till date. This kind of implies that the Indian Medical Council has actually looked at the Phase 3 data, just like we are used to looking at interim analysis, Phase 3 data, and then they said, yeah, sure, we're good. So then scientists are saying, if you have looked at that data, please tell us what that data is. So this is about the vaccine. Now, general political part of it and the expert opinions. Now let's talk about how the vaccine is made. So here is an article about the Vero cells. Vero cells are cells that are taken from African green monkeys. They are taken from their kidney's epithelial cells. That means surface cells. So from our kidneys, the urine eventually ejects from our body. So all of that tubes that come from kidney all the way to the outside is all epithelium, including the inner surfaces of the glomerular membranes, or simply nephrons, the tubes that start making and collecting urine. So these cells are taken from that part. The quality of these cells. So these cells were produced by a Japanese research investigator in 2014. The quality of these cells is that they are interferon deficient. So what they did was they took the cell, and on the chromosome number 9 of this cell, they removed a bunch of genes that are responsible to produce interferons. And why did they remove them? They don't want the cell, when it is infected, to make more viruses. They don't want the cell to become strong enough and to defend and to release interferon and tell the neighboring cells to defend against the virus. This is the same behavior that SARS-CoV-2 does automatically. So here in these cells cases, the Japanese scientists had actually removed the interferon producing genes so that when these cells are infected, they do not try to fight with the virus and they become infected and they just become a host for the cell virus and virus can replicate in them. Then we would take those viruses out of these cells and that is our vaccine. So number one, they are interferon deficient. Number two, they are aneuploid. Aneuploid means that they have more chromosomes than normal. This allows them to kind of behave like, not exactly, but kind of behave like cancerous cells so they can live for a longer time. So you can say that they are artificially created so that they can live for a longer period of time. And secondly, they can have viruses develop in them without the cells trying to fight with the virus. So that is how it is produced. Now let's continue to see how is this vaccine made. And I have a beautiful article over here that would be interesting for you. That is this article. This is an article, May 6, 2020, development of an inactivated vaccine candidate for SARS-CoV-2. So this is May 2020, so 8-9 months ago. So this is how they developed a vaccine then, and this is the same technology that is used in Covaxin. So let's now see it. In this article, this diagram is very interesting. So I'm going to explain it in my way, my illustrated way. So here we have a virus seed. This, in case of Covaxin India, that seed virus was taken from a patient who was asymptomatic and was in Pune. So for Pune is, I believe, a state. So I have less knowledge of India's states, so please don't mind. He was taken from Pune. And so the virus was then used as a seed. So what you do is you take that virus and you put that virus with the Vero cells. And now these are just cells and you put the virus and the virus will infect the cell and start replicating in it. And now you have a bunch of cells that are infected. Those infected cells are then taken up and they are separately cultured and given nourishment so that they can allow the viruses to continue to develop. And you keep dividing the cells and the viruses inside there are also dividing and replicating. So it becomes a factory. So these cells that are infected, you take those cells and you create factories from them. So these are microscopic tiny factories that are making actual viruses, SARS-CoV-2, actual alive viruses, replication capable viruses. So they would be sitting in there, they will be infecting the cells, they will be building themselves, the viruses. And so soon a bunch of viruses, or virus is already a plural term, virus will be produced. So here you take those virus that are produced and you store them, usually lesser than 40 degrees centigrade. Once you have stored them, then you go to the next step of actually now making a vaccine from them. So what you do is you take that factory that has the virus in it and millions and billions of viruses made by the factories, which are the Vero cells, and those viruses, you take them out of the cells. So what you do is you harvest the supernatant. Supernatant is just like when bees are, the honeybees, when they are in their nest, they make honey in there. Imagine that honey is the supernatant, or whatever is the fluids that are coming out and are around the cells, these are supernatants. So what you do is you take, just like honeybees, you take their honey, these are the cells that are making viruses and these viruses are the honey. So you take those viruses and separate them from the factories. Of course, that doesn't mean that all of the cells will be separated. Some cells, some broken pieces of the cell would still be part of the supernatant. So if you see here, I actually spent some time, you would say that I was wasting so much time, but I spent some time making those viruses having fun in here. So one is sitting over there. This virus I thought was looking at a sunset somewhere. Anyway, so you take the supernatant and separate the viruses. Then what you do is you take those viruses that are present now in some big bucket and you drop on them, you douse them with beta-propiolactone. Beta-propiolactone, so if I go in here, so this is about the Vero cells. This is beta or beta-propiolactone. It looks like this. Beta-propiolactone is a very important substance, and what it does is it is a spermicidal. It is not used in humans for contraceptives because it can actually cause cancer as well, because it actually attacks the DNAs and RNAs. Because of that, we don't want it anywhere near us. So that is why we kind of keep it away. However, for inactivating the viruses or pathogens, we use this. When we douse a pathogen with this beta-propiolactone, it would go and bind with the nucleic acids and nucleotides, their genetic material, and kind of destroy that, or bind and kind of tie it up. So that is a function of the beta-propiolactone. So here, what you do is you've taken those viruses now. They're all very active viruses. They're all SARS-CoV-2s. They're totally happy. They think that they've been pampered and we've been taking care of them and giving them nourishment and letting them have an environment where they can grow. But they do not know that we're going to put beta-propiolactone on top on them. Once they get that, so if you see here, this is the SAD virus now. If you see these black boxes, these are the chemical formulas for beta-propiolactone, and now the RNA of the virus has the beta-propiolactone bound to it. That is how the RNA gets destroyed or damaged. Now this virus has all the antibodies in it, but it cannot replicate. It has become an inactivated virus. It cannot go anywhere from here. Of course, in this whole process, they have to make sure that the virus itself doesn't get damaged, that let's say it is so much damage that when we inject it into our bodies, our body cannot even recognize it correctly and cannot make correctly antibodies. And when the wild type, the actual virus comes in, there is so much difference between the inactivated virus and the actual virus that body just doesn't know what hit it. So usually they have to be very careful in this process that virus body and the spike proteins and those things are not damaged, but the RNA is damaged enough that the virus is inactivated. So now if you see here, this is a SAD inactivated virus. This is now ready to be a vaccine. So then what we do is we take this inactivated viruses, they still seem very happy, and we filter them out. So here is a filtration process. So what we do is we pass them through a filter, and that filter would only allow the virus size particles to move out and the bigger particles to stay. This is like a sieve or a filter. So the bigger particle, which may be the pieces of the DNA from the Vero cell, which may be broken Vero cells themselves, which may be the whole Vero cells. So all those cellular components would get stuck here in the filter, while the viruses, which are lesser than or equal to 0.22 micrometer, they would pass through the filter and end up separated. So Shahida says, still alive. Yes, so they are still alive, but they are not able to replicate anymore. They are not able to make enzymes anymore. Their RNA is coagulated. Their RNA is fried. So their body is fine. This whole structure is fine, or mostly fine, but their DNA, their genetic material has become damaged. So when they are injected into a person, in theory, they are not able to make their enzymes. They are not able to make or replicate. They are just dead bodies of the virus just sitting in there, or as we say, inactivated viruses. And so when they are sitting in our deltoid muscle and they are inactivated, our immune system would then work on it, and I'll show you. So hopefully that answers your question, Shahida. Real world says, what is RNA? So that is a question that I'll have to spend some time on. So Barbara Warren says their RNA is fried. So real world RNA, or ribonucleic acid, is the genetic material of the SARS-CoV-2. It is the recipe within the SARS-CoV-2 that allows it to make more SARS-CoV-2s. It is the brain of the SARS-CoV-2. So what we do is just like when you fry an egg, you kind of try to coagulate the egg, right? So sometimes you leave the yolk running and sometimes you leave the yolk not running. Here, the brain of the virus is coagulated, is damaged by beta-propiolactone that has a specific affinity for DNAs and RNAs. So it won't go and combine with the spike protein and damage that, or combine with the M proteins or N proteins and damage them, or combine with the lipid membrane or the envelope and damage that. It specifically goes and binds with the nucleic material and damages that material. So now this cell, this virus is kind of a damaged virus. It doesn't have a brain anymore. So it is not going to replicate. I hope that clarifies this. Is there another question here? Somebody's saying, great question. Kosher. Jana, what was the question? Nebu says, so Nebu says that in our state, Kerala, we are given vaccine free of cost for all, about 600 million doses. Absolutely great. Country fried. John Snyder says, country fried RNA. Yes. Chicken fried rice. I'm trying to see Kosher's question. Can't see it. ZZ says, love Dr. Bean's discussion on these happy viruses that are about to be bathed and boom, inactivated. Yes. And then they become all impotent and now they cannot do anything and they're all sad. So here, this is the virus. And those inactivated viruses now, they're still kind of going, I am a great virus and everything, but they cannot replicate anymore. They cannot make enzymes anymore. They're done. So now they pass through this filter. And when they pass through the filter, most of the cellular debris of the Vero cell gets stuck here. And the virus is filtered out. This virus, when filtered out, then is combined with, see these black things here? This is aluminum. So after the virus is separated, and this is an inactivated virus, it is not dangerous anymore. And then we add aluminum to this because aluminum irritates our immune system. So this is an adjuvant that would irritate our immune system. So now the vaccine is ready. We have a inactivated virus, may I say once again, impotent virus, and we have aluminum. And so now what we do is the next discussion point. So this was how the vaccine is made, done. I hope this is clear. Absolutely correct. Beth says like zombie cells. Correct. They don't have a brain anymore. They just are cells. And they are like target practice for our immune system to say, here is how a coronavirus looks like. Learn it and work with it. Guy Telfer says, a cell that cannot produce receptors. So look, it is not the job of the coronavirus to produce receptors. Coronavirus's job is to produce spike proteins. It has the spike proteins. It can bind with our cells as well. It can be taken up as well, but it cannot make more viruses, or it cannot make its enzymes to damage our cells. Yes, very correct. Kosher says they can only induce immune response. Correct. So these are like the, may I say, dead bodies of the virus that we are showing to the immune system to say, okay, look at these guys and train yourself to attack them. So I'm going to talk about that in 1 second. So there is a question here. This is a very common question. Donning says, anybody knows of documentation about the virus being isolated? Not only documentation, we have actually shared together electron microscopic views of the virus and the slices of the virus. So that is an old question now. So there are aluminum adjuvant is a formulation of hydroxide and magnesium used in DPT vaccine too. Correct. It is used in many vaccines. I want to continue so that this discussion is packaged up. So don't mind if I. So Mr. J says that, is there controversy using aluminum hydroxide, aluminum with nanoparticles? Some folks say that it causes damage and it is a bad adjuvant. Others say it is not. So yes, there is discussions, although it is not supposed to be that way. Nabu says, why is not recommended for people who are on anticoagulation? Just so that there is going to be bleeding at the site of injection. And if somebody is on anticoagulant, they might get bleeding at the site of injection. So it is not contraindicated. They should just be observed and taken care of first and made sure that the bleeding will not be extraordinary. Okay, so let's continue to look at this. So Pune is a city close to Mumbai. High level of infection, both in numbers and density. Serum Institute is also in Pune. Vikas Gupta. Very good. Thank you, Vikas. All right. So last part of the discussion today, how does this vaccine then work? We know how it is made. How does it work? So here, imagine that the vaccine has been injected in the deltoid muscle. This vaccine, if you can see here, these sad little viruses that cannot do anything. And now with them are the aluminum adjuvants. Aluminum adjuvant over here, if you see stomping on a dendritic cell's foot, it is kind of irritating the immune system, and the immune system becomes all upset, and it was already going to look up these viruses and eat them up, but now it is irritated, it would become activated even more. Somebody had asked me this question yesterday, that how can we make sure that the spike proteins will be picked up in case of Novavax? I think the answer is very similar here as well, that how can we make sure that these viruses that are injected in the tissue will be picked up? And I had answered this question before as well. Our body does not tolerate anything in our tissue that is foreign. It would digest it, it would destroy it, or in that process it would get destroyed, but it would not leave it alone. So majority of the viruses and pathogens, all of them, are eaten up by dendritic cells or the macrophages or the neutrophils. They eat them up, they break them down, and they digest them, break them down to the tiniest amino acids, and then throw them out. So imagine these are like shredders in our tissues, who are just looking around for anything that is foreign and just eat it up and shred it and throw it out. So these things cannot just sit there forever. It's just not possible. So unless there is immunodeficiency, imagine somebody doesn't have macrophages. Remember, if somebody doesn't have macrophages, then we have infectious diseases or neutrophils. So I'm talking about the healthy systems. So here is the dendritic cell. The dendritic cell is triggered by the adjuvant. The whole immune system is going to be triggered by the adjuvant. And then it is also triggered by the virus itself. So it is going to pick up the virus. We have done this discussion before. It is going to present, it's going to break down the virus into smaller pieces and then present those pieces on its surface. And then naive T cell are going to come in and connect. And these T cell, which are naive helper cells, CD4 cells. And we know this whole process. In the presence of interleukin-4 and absence of interleukin-12, the naive T cell will get converted into T helper 2 cell, which would then release interleukin-4, 5, 10, 13. And then that would cause the B cells, relevant B cells that have recognized this virus, they will become proliferated, activated, and they would start making antibodies. Here they would make antibodies that would be against parts of spike protein, parts of the virus itself, and so on, meaning these would be polyclonal antibodies. So that is one. Many of these B cells will become memory cells as well, and we have a memory. Then it is also possible that the T helper 2 cell, CD4 naive T helper cells, in the presence of interleukin-12, which is usually released by macrophages and dendritic cells, in the presence of interleukin-12, they would convert into T helper 1 cells. T helper 1 cells would release interleukin-2, plus they would connect with the cytotoxic T cell, which if these cytotoxic T cells are connected with another cell that is holding a virus in it or presenting a virus, then these CTL cells will become active and take care of the virus infected cell. And they would also make their memory. CD4 cells would also make their memory. So the whole system would develop a memory as well. And that is the training of the immune system. Now, when the wild type virus would come in, then all of these cells are going to be ready and they would attack it. And within 24 hours, they would start destroying it and taking it out. That is the discussion about Covaxin. All right, so I'm going to stop that part and let's see. Once again, I would like it to be shorter. So if you would like to continue discussing, I can stop and then come back, or we will meet tomorrow. One more thing, an announcement. This Friday, I would have Dr. Stephen Phillips with me. He is an expert of chronic diseases. So we are going to talk about the Lyme disease, and we are going to talk about long hauler, COVID long haulers, and maybe some other chronic diseases as well. So what are the mechanisms? What happens when something becomes chronic? What is going on inside the body? I would like to ask him and see what are his suggestions to solve these situations. And also, before I close this one, please like, subscribe, and share. There is a link in the description if you wanted to buy me a coffee, and there is another link in the description if you wanted to support my work. All right, so now let's look at this, and if you like, I can come back. So there are a bunch of questions. Why not we come back? Margaret says, good night, Eric. Eric is going. Eric says, Susan P., my mom and me ate rice from elk pots for 10 years. Light. JAP says aluminum is toxic and accumulates in the body. Look, this is a very tiny amount of aluminum. It's a look at the dosage of the vaccine, 3 microgram and 6 micrograms. So a very tiny amount. That aluminum is not going to cause anything. Okay, so I'm going to stop this and then come back and we'll continue our discussion. So once again, please like, subscribe, and share. There is a link for buying me coffees and another link if you wanted to support this work, and I would see you soon.